pediatrician and integrative medicine, functional medicine practitioner in St. Louis. And she's going to be discussing with us today about building resilience for health and wellness. This is a very relevant topic, of course, now during the pandemic, during all the different stressors that we've had to face all collectively, individually and collectively, as well as at all other times of human history. So this is going to be a really special session here. So thank you so much, Dr. Anna, for coming on today.
Oh, thank you for having me, Andy. Appreciate you.
And yes, we're going to be talking just briefly about some community updates. But first, I would like to have everyone just take a moment of reflection. And we want to, I think, spotlight India for a minute here. If you could just close your eyes, and we know that there's a lot of tragedy and heartbreak going on around the world with COVID-19, but especially in India right now, which has it kind of hit the worst right now. So just take a deep breath in and out. Maybe put your hand on your heart, kind of do some HeartMath type of breathing, feeling your vagus nerve getting activated by the warmth of your hand on your heart as you breathe in and out. Bringing in love from the universe. Breathing through your belly, a soft belly breathing. And then on your exhale, just sending some love and compassion to the world, especially to India, dealing with this crisis right now. Just deep breath in and out, sending some energy there. Feeling your body, feeling the groundedness of the feet as they touch the ground, touch the earth. Feeling the breath move in and out through your body as we are inhaling and exhaling together. Just also realizing that the earth, the globe, is inhaling and exhaling collectively as we will get through this the only way we know how, which is together. Deep breath in and out. I hope you've had a good Friday so far. Keep on breathing. If you would like to, if it feels right to you, at the top of your next inhale, just take a pause for about 5 seconds there. We're always running around, and it's a good time to just take a pause and just to stop and listen to your own body. Exhale. And one more time, inhale. And exhale. So we may be discussing that a bit later about ways to help India, but just wanted to reflect on, a lot of the things that we've been through this whole year have really taught us, I believe, teacher, it's kind of taught us how connected we really are, how large and diverse the world is, but also how small the world is, how connected we all are. So it is a small world, as you kind of see here in this image of the earth on the grass, I think. So yeah, so our good wishes and prayers and thoughts and positive energy to India. Thank you for participating in that. Just wanted to have a few other announcements before we discuss with Dr. French about resilience. So we have a group visit coming up, a whole series actually on hormones. And actually I did want to say one thing about that really quickly. So all these different hormones that we're going to be covering in different group visits here in May, thyroid, adrenals, sex hormones like estrogen, progesterone, and testosterone, as well as DHEA being an adrenal hormone, but also as a precursor to testosterone. All of these, when they're in balance, actually decrease your risk of COVID because they promote immunocompetence, which means a healthy immune system. So we can learn more about that coming up in May. Jen will be doing that here with me, so I look forward to seeing you there. And I think Jen can put in the chat a registration link if you'd like to sign up for that. So hope to see you there for that. And then here has been our April schedule. We've done talks with Integrative Geriatrics, Swiss Biologic Medicine, Ergonomics, Women's Health Panel, and today with Dr. French, Building Resilience. So first of all, a little polling question. How are you feeling? And I guess this is a very broad question about the pandemic, about life in general. How are you feeling? I think this one might be a single choice answer, but happy, energized, tired, stressed, burned out, or neutral. Jen, is this a single or multiple choice question?
It's multiple if you're feeling.
That's true. I guess it makes sense. We're allowed to have more than one emotion, right? That kind of makes sense. Yes. And it's definitely possible to feel all these emotions simultaneously, certainly I know I have felt this way many times in this last year. And while you're voting, I just wanted to thank you all for joining us during your valuable lunchtime. And, this is a time that you can, hopefully this helps you with your health and wellness. Most people are saying tired is the majority. Happy, some are happy, some are stressed. Only 33% are stressed. That's, I guess right now, but I'm assuming you're stressed other times, but maybe not. If not, that's great for you. Energized, burned out, and neutral. Okay, thank you so much for voting. And one more polling question. So what have you found personally helpful to build resilience? Another multiple choice question. So sleeping well, eating well, connecting with loved ones, all very important. Yoga, we know that's one of the best mind-body practices and ways of life. Exercise / movement is more of a general exercise. And then time in nature, what we call a Shinrin Yoku. And I will say that next week we are having a gentleman named Sage come on, who's a forest bather. He's like a professional forest bather. So he's going to come on the webinar. So that should be great as well. Or other ways that we don't have listed here, you can feel free to write in the chat box, ways that you found that build resilience, that help you manage your own energy during this time. Sleeping well, eating well, and I see Liz on here, and we should put HeartMath on here too. HeartMath is a great way to build resilience. And I think we could say that mind-body exercises that focus on the breath and heart-centered connection. So let's see, the top vote getter was top time in nature. Yes, as we're all kind of stuck behind the screen, it's sometimes definitely good to get outside. Time in nature and connecting with loved ones, eating well, sleeping well were the top vote getters there. Thank you so much for the votes. So here is Dr. French, and she will be talking today with us about building resilience in health and wellness. And let me just see if I can stop. Let's do the bio first. So here is Dr. French's extensive bio, and she's very accomplished and a friend and a colleague, and certainly an inspiration to me. So Dr. French, first of all, we went to Integrative Fellowship together with Dr. Weil's Integrative Fellowship program at the University of Arizona. So that's how I met Dr. French. I'm lucky to meet her there. And even back then, I knew she was a leader in integrative medicine and integrative health. So she is a pediatrician, artist, and musician, and she has various social media sites which are very active. She has a site called A New Wellness by Dr. Anu French. She's on Facebook and on Instagram there. And Dr. French is on a mission to create healthier communities through healthier kids. And we all know that the future of our health starts with the next generation, which is why it's so important to educate our kids on how to be healthy and well. And she's been practicing over the last 25 years as a holistic pediatrician and the last 17 years as a mother. I think it's 18 years, right? Now?
Almost.
Oh, almost. Got it. Okay.
She'll be 18 in September.
Oh, okay. Happy early birthday to her. Thank you. And she's been focusing on building resilience of the mind, body, and spirit for herself, her patients, and her family. She's also been a yoga student for 20 years and has completed kids yoga teacher training. Oh, that's great. We're going to talk about that. And then Dr. French, Anu has also co-authored and published a review on yoga and children, including at the American Academy of Pediatrics 2016 clinical policy statement on the use of mind-body therapies in children and youth. She's also created a children's book called I Am You, You Are Me, about unity and inclusivity, and a sound healing CD called Wake Up My Divinity that's streaming on various like iTunes, Amazon, etc. And she also paints. Her paintings are beautiful. And looking them on Facebook for Mind, Body, Spirit Balance, and offers her healing acrylic artwork called the I Am series and I Am Vita line of clothing to support global literacy for life and social justice programs. And she also serves on committees for Integrate, which is a national grassroots interdisciplinary network of trauma-informed providers who provide trauma-informed care through the lens of mental health and accessibility, and also for I Am For Us, which is an integrative medicine for the underserved. So that's a whole list of accomplishments, and I'm sure not everything's on the bio. So thank you so much. It's so great to be with you here, Anu, and thanks so much for joining us today.
Thank you so much, Andy, for having me. It was so nice really nice to see you and catch up after all these years.
Yes, exactly. Yeah. So I think we should start with that. We'll start with a shout out to how we met. So maybe if you want to briefly talk about how you got into integrative medicine and kind of your experience in the Andrew Weil Fellowship training first. Maybe we'll do that first.
Yeah, I think, I mean, I was just thinking about where I was about 15 years ago. I was just so burned out, and both professionally and personally. And then I remember I was physically ill myself. I had all these labels put on me by other doctors, fibromyalgia, right. Chronic fatigue syndrome being the big ones. But I also had two little girls at the time who were also, had asthma and allergies and reflux and all of these things. And all these, we're all on so much medicine. And I was just really desperate to find some other way of treating illness and maybe even focusing a little bit more on prevention. And that's sort of stumbled on the fellowship, and Dr. Andrew Weil's fellowship and decided to do it. And actually it was so interesting because I wasn't really, the focus at that time wasn't to do it to practice it. It was really just to heal, and to find some kind of balance and not really knowing where to take it from there. But I think that was where I just realized how important resilience is, like building resilience. And my children had, I went through a divorce at the time, and my kids attended this this thing through their school called Kids in the Middle. It was a wonderful program for children of divorce, and they came home with these pamphlets on ACEs, adverse childhood events, and I actually hadn't ever heard of it as a pediatrician, and I thought I should really know about this. And at the same time, I met Julie Johnson. We were it was in a greenhouse, at an organic farm. They were doing a yoga event for children.
Oh, cool.
And so we were there, and she and I, we kind of connected, and that started sort of the grassroots movement of like, how can we connect people who want to learn more about ACEs and be trauma informed. And now she has taken Integrate to a whole nother, it's a national level right now. It's a beautiful platform for anybody who's interested. On Facebook, you can join their group, and they offer all kinds of trauma-informed resilience building tools and workshops. But so that was sort of the journey, with the Integrative Medicine Fellowship, and then also, trying to become part of these groups that, it's one thing to learn about childhood trauma, but also how do we take that to a place of empowerment, right? And use it to build resilience. So.
Yes. Just to share and kind of echo what you said, I also went through the Dr. Weil Fellowship training also for self-healing. I felt that I needed to find more of a community of like-minded healers, and I didn't necessarily find that in conventional medicine. And it was about learning the knowledge to help patients and things, but I knew that you always start with the middle with yourself. The whole idea of this, I think some of the integrative medicine conferences, you throw the pebble in the middle of the lake and it ripples out, right? Or the whole idea of what Gandhi says, which is to have change, you have to be the change. You have to start with yourself.
Right. There's a certain level of integrity, right? If you're not really practicing what you preach.
Absolutely. Right? That is very true. That is absolutely true. We can jump a little bit to ACEs. So can you again define ACEs? Because I know that's a big topic for a lot of people. And we know that, we see more adults here. We do see some adolescents, but we know that ACEs can also translate into adult trauma, right?
Right. Yeah. And I think I always, whenever I've talked about ACEs a lot in the last 5-6 years. And I think whenever I sort of review this topic, I'm aware that my own trauma comes up. And I also just want to be sort of cognizant of the fact that this topic can sort of be a little bit disturbing and uncomfortable, and maybe a little bit anxiety provoking for
Yes,
people when you start hearing about it. So
that's
I
true.
just always like to bring that up and just say that, our hope at the end of this talk is that, we're talking about these things so that we can raise awareness, and also that it's extremely freeing, I think, when you know that you actually can reboot some of these things that have happened.
And if
so
someone has severe trauma, you would recommend, or ACEs or trauma in general, you would recommend therapy or those type of
Yeah, I think the first step, like just understanding that an adverse childhood event, is helping us, when a child walks into the office, you don't say, what's wrong with you? It's like we're kind of reframing it as what's happened to you, and Dr. Nadine Burke Harris is the pediatrician really who got this all started, back in 2011, the Resilience Project through the AAP. And then, she did an amazing TED talk in 2014 about how this affects, and just really raised awareness amongst pediatricians. And the AAP came up with the trauma toolkit. And so I think the important thing is that an adverse childhood event is where there's continuous trauma of some kind in childhood. And there's 7 or 8 varieties of that, but there's like, emotional abuse, physical abuse, sexual abuse, parental neglect, alcoholic parents, divorce, suicide in the parents, things like that. But I think I also want to bring attention to sort of the modern day ACEs, which is social isolation, bullying, peer rejection, community violence, and the pandemic, just everything that's brought to us. So I think that what happens when you have that kind of trauma is that, your body gets turned, the inflammatory response gets turned on, and your neuroendocrine system gets turned on, and then you become more reactive to smaller and smaller stressors. So that's kind of that's one piece of it. But then you sort of stay in that state of chronic inflammation, and then as you get older, it leads to chronic disease, and then it leads to more of social challenges too, healthcare challenges and public healthcare issues. But the other part of it is that it's not just the ACEs of the child who's experiencing it, but the ACEs that the parent or the caregiver also experienced when they were a child. We've got landmark studies now in pediatrics showing that what happened to the parent can also impact the outcomes in the child. So more chances of hyperactivity, aggression, anxiety, academic failure.
So that is that kind of like epigenetics, where there's methylation, or other, like trauma almost gets inherited from
embedded. Yeah, it becomes embedded in the genes.
Wow.
Exactly. And so I think if a child walks into my office with a history of trauma, this is where we're trying to become more aware of the fact that toxic stress is a biomedical problem. So having this artificial, separation of social history and medical history does just not apply anymore. All history is relevant to what's happening to the child. And I think I always like to just sort of talk about the types of stress, because I think it's important to understand, like right now, what I'm going through is healthy stress, being on the webinar, it's nice to do the HeartMath, because you bring back my heart rate variability, raise it up a little and make me a little, but this is normal, healthy stress. And as soon as the webinar is done, I'll bounce right back. Right. But then there's also tolerable stress and toxic stress. So tolerable stress is more like, a death of a parent or death of a pet, or, moving school, or divorce, and if you have consistent buffering adult relationships in that situation, the body does have a strong inflammatory response, but they can bounce back. But the toxic stress, unfortunately, like you said, it's, if you have repetitive, constant stress, then what happens is it just gets embedded genetically. It affects the size and shape of the brain structurally. It also affects the telomeres, like you age quicker, so there's all those changes that happen.
So
too.
Toxic stress means it's repeated stress that doesn't have a buffer. Is that basically what?
Right. Yeah. But it's just happening again and again and again. And I think the ACEs research shows that, if a child has come through all that trauma, even at that point, if there's one consistent, loving adult relationship in their life, and it doesn't have to necessarily be the parent, it could be a teacher, it could be a coach, you can reverse all of that, or reverse all of the trauma. So I think that the concept of intergenerational, building resilience on 2 levels has become really, really important.
Let me ask you something, Anu, about ACEs. So let's say you have someone that first 18 years of their life, or most of that time, had ACEs, didn't really have that adult to buffer and to help with the resilience. Can that person as an adult then reverse the ACEs as well?
Right. Yes, absolutely. And that's where, like, now, because we're seeing, we used to think that our brain was static, right? Now we understand the concept of neuroplasticity, right? So, so just rewiring the brain, the neurons that fire together, wire together. So just creating these new pathways, right? And getting ourselves out of that default mode network, which is our sort of when somebody does something that we are reactive to, we sort of immediately, our body responds in a certain way, our mind responds to a certain way, we're kind of wired that way, but we can rewire this. And so, yes, absolutely. And that's where resilience building can really reverse these, what I call, I guess it's a toxic soup almost that you've kind of been in for so many years. But the beautiful studies showing how, those epigenetic changes, actually you had mentioned about methylation, how the methyl groups kind of jump around, sometimes the ability to turn off stress, those genes get turned off, but you can turn them on again, where you can actually control your stress response from an epigenetic standpoint.
And then in theory, you could even reverse, through generations. I mean, it would take lifetimes, but you could potentially even reverse intergenerational stress, correct?
Absolutely. Yeah. And so it's like, I always talk about, I want to be, a change maker and a chain breaker, I think of sort of the epigenetic trauma of my heritage, whatever that might be. Like I always take the example of endometriosis, for example, just every woman in my family for 7 generations back suffered with problems with their reproductive health. And so I remember when I went into puberty, I was just sort of told, well, this is how it is, like we've all suffered like this. And so this is how it's going to be. And I was like, well, I don't want to accept that.
Right.
There's got to be a way to change this. And I feel like my daughters now have a much healthier reproductive life than I had at 13 because of this knowledge. It's empowering to know about how we can change, right, our genetic expression.
Yes, I've seen a lot of people come in. Can you hear that? There's some buzzing outside. Maybe not. Maybe it's okay. For a lot of people, I've seen that they might say something like, initially when I see them, they might say something like, well, diabetes runs in my family. And so, my grandparents had diabetes, my parents had diabetes, it's likely that I'll get diabetes. That it's sort of like echoes what you just said there.
Right. Yeah. And I think that I love, there's a lady called Donna Jackson Nakazawa, and she's written a beautiful book on, and one of her quotes is that we can rescue ourselves. I always like her words. Yeah. And so when you talk about an adult who's presenting with, they're suddenly discovering, oh my goodness, I've gone through all this trauma and maybe it's connected to the disease that I'm suffering from today. I think just being aware that there's a connection itself is important.
Yeah.
And then realizing that there are lots of tools that you can use to reverse these changes, and that itself, we're neurobiologically resilient, just not just emotionally resilient, but that our brains, we can actually change, we can increase the size and shape of our brains, we can improve the longevity of our telomeres and our
that's really amazing through different practices, which maybe we'll talk about some today, in both in terms of your professional life with your patients and your community, but also with maybe even with your family, your personal experiences, like what you've kind of felt has worked for you. There is a question here listed here on research behind toxic stress and inflammation. So I think you kind of went through that, but basically, if someone has toxic stress, there's methylation issues. Does stress also, because we know, if you think about someone that has inflammation and that NF-kappa beta is higher, right? Then this is just something I've really been focusing on more in the last year. It's like even things like anxiety and depression they can be linked to brain inflammation and basically increased levels of NF-kappa beta in the brain. But even things like joint pain and rashes and a lot of gut issues, right? There's a lot of inflammation there. So a lot of times, I know for me and probably you as well in medical school, is kind of like, well, there's the mind and there's the body, and they're not really linked.
Right.
It's like back to the 1500s or something. It's
Yeah.
all separated. No, you should like now I think it's more overlapping. Like I just talked to a psychiatrist yesterday who really understands that mind-body connection. But I know when I was in school, it's kind of like, okay, we rule out all the organic things, rule out heart disease, rule out, do a CAT scan of the whole body, and then if all that's negative, then go send them to a psychiatrist, right?
Right. Yeah. And it's so interesting. Yeah. And, I think we both come from sort of Eastern cultures, right? And I remember growing up in India, the concept of the mind-body spirit connection was just intuitive, and it was intrinsic to, like we just grew up understanding that. And then I feel like I went to medical school, and then I came to the United States, and it was sort of like not beaten out of me, but I was just like, it was kind of like, they were like, well, that's not how it is anymore. And so then I feel like after doing the fellowship with Dr. Weil, I sort of came back full circle. And then in my own personal life, of course, also just seeing how powerful these tools are. And, I loved how you said in the beginning, let's send the love out to the universe, like, I think that really understanding that interconnectedness is so important in building. I mean, I think it's really important to build resilience for yourself. And then obviously I'm, very focused on building resilience in my children, because, like if you look at an ACE score, like you can get your ACE score, and it kind of gives you a predictive value. And again, I always tell people not to focus too much on these predictive values, because again, it can make you anxious. It's really more about focusing on how do we build resilience. But one thing that I did learn from my children's, the paperwork that came back that day from the school, was that because they were kids of divorce, they had an ACE score of 1. And if they had an ACE score of 1, it doubled their risk of having a stroke as an adult, unless, so things like that. And so I was like, okay, I got to build it. But I think, now really building healthy communities through healthy children. So if we can build resilience in our patients, and then in our families, and then in their communities, it's just really this interconnectedness is becoming so much more important right now, especially with the isolation that we've been facing.
Yes. So another question on here, and this is another broad question here, but what is trauma and what is resilience, and how does one build resilience? I think that's a good place to start, and then maybe we can talk about more specific things after that.
Yeah, I think there's so many definitions for trauma. I mean, we have sort of trauma that happens personally in your life as a child, and I mentioned a few of those. And then we have sort of trauma that's collective trauma, like, war and community violence. And of course, this pandemic, there's just some great graphs showing how the traumatic effect, of this pandemic is sort of like the stages of death and dying, Elizabeth Kubler-Ross's stages, where we're first in denial and then bargaining. And then
it definitely was denial in the first round.
And then depression, and then hope, and then, but I think for me, the definition of resilience is the ability to bounce back from an adversity. And I think the most important piece of that definition for me is that resilience is not an innate trait. It's something that can be taught and learned. So that's really powerful to me. It's like anybody can learn to be resilient.
That's very empowering. No matter how many generations of people have suffered, we can, like you did, you said seven generations of women having endometriosis, and you kind of put your foot down, like enough's enough. Like there's something that you can do about it. Yeah,
absolutely. And I think that, for me personally, methylation has played a huge part in my reproductive health. And I didn't know about that for so many years until I kind of became an integrative person and understood the connection between, how we have a blueprint and how it expresses itself based on how we live, right? And so for my girls, I got them screened and started on methylation support earlier on in their prepubertal years. And I see how that's impacted. And I look back to my childhood and how it could have changed. So that's just a simple example, but I think that's one, I think building resilience begins with, I think the forest bathing, my goodness, wonderful, like being out in nature, right? Just being connected.
That was the top vote getter today, I think. On
and some of the basic things which we already know about building resilience is broadly is like, eating clean and drinking clean water and, trying to live in a cleaner environment and cleaning up our attitudes and our thoughts and our,
well, that's a good
that kind.
Yeah.
Yeah. Right. Yeah.
Right.
So yeah, some of the basic. So some of that is basic. But then I think when you're talking professionally of how do you have a person in your office who has clearly experienced trauma and who's clearly experiencing chronic disease, and we are taking care of them medically. We are definitely doing everything wonderful. The hormone group visits that you're going to do, those kind of specifics are so important to understanding the neuroendocrine system, but also how do we, so I think trauma informed care is very important. So I think when somebody walks into my office, the first thing really is to create a safe space, right? A space where they understand that it's a sacred container and that it's private and that everything and that we don't re-traumatize. So I think that's one of the most important things about trauma-informed care, is that we don't talk about all of these things that happened to you in your childhood without giving them some sort of tools to take home to deal with it. And I think trauma-informed EMDR and trauma-informed cognitive behavioral therapy, great studies actually showing that, we talked about those breakage in the DNA and the shortening of the telomeres can actually be reversed by doing that kind of trauma.
Awesome.
And also that lasts for another, like a whole year after you stop.
In those studies, how long did the EMDR or the CBT take, in terms?
Yeah, this was about a year of doing therapy. And then they continue to see positive changes even a year after therapy was stopped. So again, that's talking about how some of those basic things can change. So but then I think on a personal level, I remember last March when the pandemic hit, I sort of lost a lot of I was going to the gym and I was going to yoga and I was going out with friends and, going out a lot, and suddenly we're on lockdown. And I realized that, I had to sort of rebuild my tools of resilience personally. Like you got to do this on a daily basis and not be looking to, not necessarily always going out somewhere, or looking for outside resources. So that's where how to build resilience on a personal level became even more important to me.
How did you do it yourself, if we don't mind talking about that?
For me, I just think about my day, like waking up in the morning and having a few quiet minutes of mindfulness. And, I think meditation can be a trigger word. I find things like meditation, yoga sometimes are trigger words because people have tried them and it just hasn't worked, or it just seems very intimidating. But I think just even mindfulness, sitting, even just listening to the birds singing out the window, or my children screaming in the background, or whatever's happening.
That's mindfulness, being mindful of what's happening. The children screaming.
That I think just making that a practice, just to have those few quiet moments before the world just starts, And then the other thing that I like, I think in the shower, I found it really helpful to hum or tone. I think vagal nerve stimulation, just trying to soothe the system before we get out into the world or before we go to bed at night, depending on when you do that. And then the cleansing nature of water. So some of these things that I do on a daily basis. And then chanting, for me, mantra, Sanskrit mantra is my go-to, but again, it may not be everybody's cup of tea, but they've shown, any kind of repetitive chanting, whatever faith, whatever spiritual practice, whatever religion you follow, whether it be Gregorian chants or Native American or, Islam or Judaism, whatever the kind of the chanting, but the repetitive nature of it is very important because we know we're all energy, right? And so finding that energetic connection. So that's important for me too. And then also intermittent fasting was another thing to build resilience, trying to keep, because it helps vagal nerve, resting the belly. So
that's true.
So those are some of the things that I've, sort of had to bring in, something that I was doing on a daily basis, and then I think also the intergenerational piece of it is like, how do we create practices within our families where we're building resilience on both levels, And HeartMath actually has been a great tool within our family because, we're all in different rooms, but we're all on HeartMath and we're all on a global, like in a coherent app, and we're watching, things getting bigger. So we're connecting, even though we're all not sitting together.
So your kids are in a different room and then they're doing the HeartMath, and then
everybody's just got the little monitors on, and so the app is universal.
That's great. Yeah.
So just because I think some of those I think I always I joke about how apps are like the gateway drug to mindfulness.
Like
because,
Calm and all the different apps.
yeah, just because kids, you know, it's very hard to get them to just sit and meditate, right? But they usually will respond to something on a screen, right? To get started at least. Yeah. So that kind of thing.
Way, yeah.
Yeah. But those are some of the things I think. And then I think I always like to give a shout out for art. You know, this is something I do a lot with my kids too, is messy art, you know, like where we're really getting into it, and lovely studies looking at art. You know, it doesn't matter whether you're a good artist, it doesn't matter what medium you use, it doesn't matter how long you do it for, but it drops cortisol, you know, cortisol.
That's great to know. Yeah.
Yeah. So I think, again, some of these practices of doing things with, and again, I always talk about how building resilience doesn't have to be, you don't have to make it difficult or challenging. You don't have to go outside or go to therapy. You can do these things daily in your life, you know.
Aren't the messiest artists the ones that 10, 15 years later sell something for like 20K or something? I'm just joking.
I know. Yeah, it's always interesting, like, to see the kind of art that
I didn't know that about the quality of the art. Like, it's not really about what you're doing, as long as you're doing something. It's very
right. Yeah. And it sometimes feels like, you know, they've done great studies looking at quality of life and resilience scores and things like that, and you know, really showing how art can be so helpful, you know.
Probably
and
any type of art. You're saying like painting, pottery, like anything?
Anything, yeah. And I think, you know, creating things, right? Creation. So even cooking, robotics, I always talk about
art.
Yeah. And anything that where you're actually building or creating can be great. And getting your hands sort of involved, like the 3-dimensional piece of it, you know, Jenga blocks. I always talk about Jenga blocks.
Oh, that's a nice
Jenga being a great mindfulness practice to do with your children.
And a lot of times we're really in this thinking mode, like thinking about the pandemic, thinking about the social isolation, or, you know, all these different things or things we have to do. And that's like often the left brain, you know, kind of analytical. So I like the creative mind. That's why I love acupuncture. You know, I did some training in medical acupuncture. When you put in the needle in, either myself or with a patient, you know, you're activating this creative side, like this right brain, and it's very hands-on, and you're touching someone, or, you know, touching the needle, and you're feeling the feeling, I guess, of the needle, you know, in your hand, and you're just feeling the skin and all this stuff. So it's also a creative process, but I do feel that provides that balance there when you do some creative
Absolutely. Yeah. And I think, you know, it's becoming so much more important. I think, especially we're spending so much time on screens like this, right? To do, like you did, the beautiful sort of like that meditation you did when we started, like dropping into our bodies and getting aware of ourselves. And I think the Shinran Ryoko, the walking meditations, you know, I think being out in nature and just some people can't meditate sitting, you know, and they need to move. So mindful movement, yoga, Tai Chi, and just walking, you know, just a simple walk out in nature.
Keep your eyes open when you're doing it, you know.
Right. Yeah. And I remember when my kids were younger, we would do the walking meditation with them, and we'd just say, everybody just hold a word in your mind, you know, until you're done with it. It's just a few minutes, and then we come and sit down and talk about what word it was. And, you know, when words like ice cream, you know, it didn't have to be something very big like peace.
That's a great idea.
Yeah. So I love the walking meditation with children is another great way to build resilience. Again, talking about things that we can do as families. So we're building self-regulation together, you know?
Yes. And music as well as a creative process. I know you do music as well, correct?
And you know, that sound healing has been such a huge part of my own healing. I think, I mean, again, coming from India, just understanding this concept of the energy body, right? The chakras, the energy centers, and how they're certain musical notes for certain, and these ancient traditions that have used sound healing for years, you know, the Tibetans and Native Americans and the Africans. And, you know, we have amazing drumming circles here in St. Louis, so you can go join a drumming circles also have shown. But I think, again, that has been hugely healing for me. And my children, I was trying to teach them mantra. That's where the music sort of came from, because they were not really keen on learning Sanskrit mantra without understanding what it meant. And so that's where the music that I created sort of came from, that trying to create East and West blended music and helping them understand what it means, so that they're more, you know, prone to actually wanting to do it. So
yes. So I know, okay, a couple questions. I know we want to make sure to not run out of time, so we don't activate our default mode network and cause more limbic system activation. So a couple of things. I I know Sharon, you said something about faith and spirituality. Oh, I see that. That means something that she was saying that cultivates resilience.
As the questionnaire.
That's a question. This is a bit, this might be interesting. I'm not sure if Audrey, you mean about resilience. Maybe this is a resilience thing too. She was saying that supplements for the gut can be helpful. Of course, we know that that's a great point, Audrey, is that when you activate, you balance the microbiome, of course, you're actually downregulating some of those inflammatory T cells, inflammatory macrophages. You might be changing that pro-inflammatory to anti-inflammatory macrophages, increasing T regulatory cells, decreasing gut inflammation, healing the gut, healing leaky gut, things like that. And actually, there's a concept in integrative psychiatry that you probably know more about that than I do, but this idea of psychobiotics.
Right.
Can you kind of delve into that for a minute, just if you don't mind?
I'm just trying to think. I mean, I think that I have fresh respect for probiotics, because I think I always like to tell families all products are not created equally and they are live organisms, and so I think when we're taking probiotics, where we are like activating our this what I call the neuroimmune gut axis, for lack of a better word, right? And so there's a constant feedback loop going on, and so I think that we're learning more and more about specific strains of probiotics being helpful in certain psychiatric conditions. But I feel like what's more important, like you said, is really like feeding our gut in a healthy way, with prebiotics and probiotics and fiber, because I always say most of our brain is in our gut. Most of our brain is in our gut, the gut, and most of our immune system is in our gut.
Do you have any favorite? Yes, most of our immune system, like 70-80% at least, are in our gut. Do you have any recommended, and then we'll get back to some other questions, but do you have any recommended brands of probiotics you recommend? I would say I would agree with you, Anu, that food is really the best, prebiotics, doing the fiber, doing the fruits and vegetables. Are there specific supplements that you like, that you use in your own practice or personally?
Right. I think that when I recommend probiotics, I usually recommend the Claire brand.
I like those.
The Claire brand. I just think that they are, they're kind of good on the consumer labs reports.
Yes.
But I do try very hard to tell families to really, we try that, from birth, we try telling people to start, obviously nursing, breastfeeding and having the mom eat healthy, but also just once we start introducing solids and getting babies to be eating, to start a wide variety of foods from a young age, and really introduce those fermented foods and, those, some of the prebiotic foods and fibers early on. So that's kind of really where we
get the palate kind of tasted ready for that.
Right. And, just get that microbiome well established early on. So.
Yes. Does doodling count for creativity?
Yes,
I would say.
Absolutely. I know I saw that post recently about that boy who was doodling all over his home, and then a restaurant saw that and they hired him to do doodles for their
amazing.
Absolutely
as well. Great. Really resonate with the daily rituals. Tony is saying yes. Great. Thanks, Tony. Jenna is asking about my 14-year-old experienced bullying in grade school. I know that's an unfortunate but yet all too common thing. That is definitely a source. It sounds like that could be a source of modern toxic stress, is the whole bullying, the in-person or online bullying. Is this something she needs counseling for? Can I help her heal? She prefers not to talk to a stranger, and I want her to move beyond this trauma. Thank you for that question.
So I think it's so important that a child who's been traumatized like that may not, you have to be careful who you choose to take them to for counseling. So you really have to make sure that the person is trauma informed, because repeatedly bringing up the traumatic event may not be a positive thing.
That might be traumatic in and of itself.
Right. Yeah. So I think some of the tools we talked about today would be a way to start, some of the, mindfulness practices, some of the HeartMath. I think that's just a great way to connect with teenagers, because they are always open to technology, and it's such a simple way to get everybody's heart rates coordinated within the family, to start having some of that self-regulation with the family before you take them out, especially if the child is resistant to counseling. It's probably not going to be a great start.
And Jenna, if you have done this already, but we are having some future HeartMath sessions here, so you can contact us if you're interested in that here at CIH. Who was the woman you referenced earlier that had an impact in ACEs? I think it was...
So Dr. Nadine Burke Harris.
Nadine Burke. I'll try to type it in.
I can type
Burke
it in, right?
Okay, Burke hyphen Harris, is that right?
I think it's all separate words.
Okay, thank you.
Sorry, I'm slow at this.
Yeah, no, that's okay. And then, are we all kind of needing more resilience? I mean, are we all kind of traumatized by the pandemic, I guess? Or
yeah, I feel like, that's what I was talking about. And maybe I'll send that to you later, Andy, is that there's like a great graphic from Samha about that and how we're actually now in the recovery phase in the United States, because we're rebuilding right now, and cases are sort of slowing a little bit in hospitals and have come out of the overwhelmment, and we're going into summer, which gives us so much opportunity to be outside. And I think that, I feel like, that's why I come back to integrate that platform, because I think we need to be finding collective ways to deal with, to build resilience beyond ourselves also.
Yes.
And, staying connected, within healthcare, of course, the healthcare providers definitely had a rough year.
So integrate is for the public, or is it for healthcare providers, or?
It's anybody can join the Facebook page, because the resources on there are for anybody. But there, within Integrate's website, there's resources for trauma-informed providers.
Okay. Yeah. Send me a link on that. That'll be great.
Yes, I will. Absolutely. Yeah.
That great. Absolutely. And so let me see. There's some other questions. Okay. I did write something about drumming circle. If anyone's interested. Maybe something post-COVID, would be something pretty interesting to do at some point. It's just an idea that came up as talking to Anu here. So
yeah, right. They do it over here. Most of them are outdoors and socially distanced.
Yeah.
And masked. Okay. Yeah, people still do it. Yeah, it's wonderful.
Got it. Okay, great. And then you're offering an upcoming sound healing workshop. Do you want to talk a little bit more about?
Yeah, sure, absolutely. Like this is something through the Integrate platform. They offer lots of different workshops, yoga, mindfulness, and this is something new that we're trying, which is mantra. So I'm going to talk a little bit about the neuroscience of sound and sound healing in it, just why mantra has been so valuable to my healing personally, but also talk about chanting and introduce a seed mantra, a basic mantra for people to chant, and
That's
then
great.
Also talk a little bit about the practical spirituality that I try to bring into my day-to-day life, which I'm trying to, teach my children too, because, Hinduism is such a broad concept and construct, but how do we take those practical pieces and bring it into day-to-day life, right? And then I'm also going to offer, like at the end, the last 15-20 minutes, I'll be singing some of my music, which is meditative kirtan, which is again blend of East and West, that's what's streaming, on all those platforms. So
I want to attend. When is this? This Sunday?
This is Sunday. It's from 7 to 8 Central Time.
So 8 Eastern, right?
8 to 9 p.m.
Yeah, 8 to 9.
Okay. And I think if you go to my website anufrench.com, right on the top is the link to sign up if anybody's interested. Yeah.
Great. I want to hear you sing. So I know you have a great voice. So
thank you.
Let's see. Got that. Okay. Yeah. So this is a really important topic, and I know this is something that we are going to collectively keep on, working on, both individually and collectively. Right. It sounds like, just going back to the polling question, people really were resonating with definitely being out in nature, connecting with others. And then I think it was eating well, sleeping well. Yoga, I think, was up there as well. HeartMath, like you said, is a huge way to really, and a very practical, accessible way to access the autonomic nervous system balance.
Right. And then connection, right? Just staying connected with people, I think, is becoming so important.
Staying connected. What are your main takeaways for building resilience? I think we're going to come up to the conclusion here. Main takeaways for building resilience. And I would even say, from a perspective of how do we stay connected with each other during the pandemic too?
Yeah, I think, I think that for me, the main takeaway is like, what is something that I can do every day? Right. Because it's great to go away for a retreat or go away for a vacation or get away for a little bit, but then we have to come back, as I call it, to the chaos of my life, the abundant chaos of my life. So how can I, even when I wash my hands, can I be mindful every day? When I wake up and when I'm, taking a shower, can I be humming and be mindful? When I'm, cooking, can I be mindful? So the sort of being present in the moment, is, I think the takeaway message is like, that's the most consistent way to continuously build resilience in
Got it.
one's
And
life.
it's kind of like what Fred Craigie says. He's the professor of spiritual health. He writes in his books about finding the sacred in the ordinary, finding the miraculous in the day-to-day things, So that's a great reminder of that. Washing your hands, even like talking to people, like I'm talking to Anu right now, my mouth is moving, I'm listening to you, and my brain's working. That's a miracle. We're all together around the world, and this is cool too. It's amazing.
Yeah, I always talk with Mark Nepo has a book called I think 1,000 Ways of Joy. But in that there was one chapter where, I didn't really like washing dishes. I kind of found it to be a chore. But then he turned it around when he said, well, when your hands run under the water, it can be a mindful moment.
Oh, okay.
And it kind of just changed everything for me. Like now my washing dishes has become mindful. And then, we have to wash our hands before and after every patient, right? So for me, it's like a moment I walk into the office and then I just disconnect for like that 30 seconds as I'm washing my hands.
To meditate.
So that so just clearing out what was before and clearing out what's coming. So those kind of things I think can be really powerful tools, and everybody's, especially now with COVID, we're washing our hands a lot. So
yes, Ellen had a comment. She said she once went to a meeting where there was long meditation with Indian chanting, a large group with many chanters. Some of us were just silent because they didn't know the chanting, but it was amazing and transformative, and it would be great to attend one of those again. I would say definitely attend Dr. French's chanting talk, I think on Sunday. That would be.
Yeah, and I think I want to make it clear that, you don't have to know how to chant, like you don't have to know Sanskrit. We're going to keep it very simple. But I also talk about how just even listening to it, because there is a vibratory medicine to these chants. And sometimes I actually feel not understanding what we're saying is more powerful, because then you don't get lost in the meaning of it and what it means. You're just basically imbibing the sound, the vibration of it. And just sitting in the silence of it is also very, very powerful healing.
Both
in fact,
silence,
when I teach mantra here locally, I always talk about how the silence after chanting is as important as the actual chanting.
That's good
itself.
to know. And definitely, from my research after doing some of the HeartMath classes, we realized that music added to HeartMath, or sound added to HeartMath, is so additive, so synergistic, and how sound and music is really the original language that developed before our languages. I think it was like, humans before, we said stuff like words, it was, I think, sound and music. So that's almost like very primordial, very healing to that. Yeah. How do we sign up? I think a bunch of people want to have you come, or they want to come to your Sunday. So
I was trying to think, can I send you a link? I mean, it's on my website, anufrench.com.
Yeah, no, just send a link here. Just send a link.
Yeah, I'll send you a link to you.
On the
sure,
chat,
absolutely.
On the chat.
On the chat. Oh, yeah.
If possible,
yeah. And I can put it in the chat. I found the link.
You found the link. Oh, thank you.
Got it. One more question, I think, is, Anu, what is your morning routine, if you wouldn't mind sharing kind of what you do to build resilience?
Yeah, absolutely. So, before I make sure that my phone is not in the bedroom, because I have a tendency to want to reach for it if it's right next to me. Yeah. So I don't have all that EMF.
Yeah.
And then I actually sit up in bed before I even put my feet on the ground, and I just 5 minutes, I just sit quietly, and like I said, I don't try to chant anything. I don't try to focus on anything. I've kind of given up on all those kind of meditations. I just feel my body in the bed. How do I feel in the morning? Just get kind of mindful. And then I just focus on all the sounds around me. There's always stuff going on around me, and just get mindful in that moment. And I feel like it takes away the resistance, just takes everything away. And then I usually, like I said, I hum or chant in the shower, like a lot of toning. And we know with vagal nerve, it's the low tones that are very important. That's what's more important for vagal than the high tones. It's the low tones that are very important.
Great to know.
Yeah, and then I also, washing hands. Like anytime my hands are under water, I'm very mindful. So that's a morning practice. The other thing that I've learned to do a lot is try to do things with my left hand instead of my right hand. Again, can bring balance to resilience. So try to brush my teeth with my left hand. Try and do some things. Yeah, so just
building some neural networks there. Because you're right hand dominant. Yeah.
Right. So some of that in my morning routine is definitely there. And then I always do a little bit of HeartMath, heart-focused, breathing, because that's, I really need that when I'm dealing with my teenagers.
Yes, a lot of shout outs to HeartMath today.
Yes.
And yes, HeartMath is a great technique and a way of kind of being, in your daily life, I think, we realize so much, more and more that what we really need is mindfulness, but we need it in a functional way, like meaning how are we gonna bring that mindfulness in the moment that we really need it.
Right.
Emotions,
Practical.
difficult, how you balance it out, so you can kind of go on with your day and not reject it, but transform it more and just kind of.
Absolutely. And just being able to come back to that every time, we're all living chaotic, stressful lives. I mean, like I said, the stress, the tolerable, healthy stress is going to be there all the time around us. So bouncing back is like reaching for these tools in the moment, and I so think I love the body scan that way, right? Just
that's nice.
Now sitting in the chair, just being able to drop into it.
Yeah,
so
the posture. Thank you so much, Anu. Great to connect with you. We'll talk
Thank you
soon.
So much for having me.
Yes,
it's so nice to see your smiling face too.
Yes, you too. Okay, I'll talk to you soon.
Okay,
Thanks
take
everyone
care.
for coming.
Okay, thank you. Bye-bye.